So this is sort of a common thing. I saw this patient in my office and she just said, "Make me look better," and I think I need a breast augmentation. What happens when patients come to my office, I have to talk to them and kind of say, I don't think this procedure is necessarily the best for you. So in this particular case, I actually told her, your breast is a little bit droopy, the nipple's a little low, so I recommend you get a lift, mastopexy, and I also do a breast augmentation at the same time. So that's what I offered to this patient and did for her. And I just feel overall the result looks a lot better than just doing a breast augmentation. But what are your thoughts on this case?
Yeah, I would agree 100%. I think often when our patients come in, they're really seeking our advice. That's the best thing we can give them, after all.
Right.
And very often people just say, well, I want an implant. They're not sure. So we have to educate our patients. And one of the guidelines we look at is the degree of structural settling of the breast. If it's below a certain point, if the nipple's dropped, if the breast is deflated, if it's lost its structure, if you just put an implant, what you're really going to end up doing is create a heavier breast, and over time the implant's going to drag the breast down further.
So let me ask you this, what do you do? I have this also. What do you do with the patients where you tell them all this and they're like, I don't want the lift, I don't want the scars. So what happens in those cases? How do you counsel them?
Well, I think it's important to do what's right for the patient. So if somebody's severely ptotic and they just want implants, it's perfectly okay to say, I just don't think I have the skill to achieve what you want. Now there's these intermediate cases. Sometimes, for example, you can do just a little periareolar tuck. It's not a very good breast lift procedure, but sometimes if it's really just a matter of getting the nipple and areola into a more balanced position and you're just doing a little bit of an adjustment, that can work. But with this patient, I think the choice of doing a lift along with the augmentation really is the best one, and it really offers the best long-term result.
Yeah, that's what I also feel. A lot of why patients come to us is for patient education. And I think when we talk to them about lifts and augmentation and breast implants, we're really sort of presenting all the options and trying to tell them what's best. And I think that's what's key about plastic surgery. Our experience and our knowledge and our skill set. They come in saying, I want a mommy makeover, I want to look better. And then we tell them exactly what we think is best.